is an assistant professor at University of California, San Francisco, where he studies and teaches leadership, teamwork, and decision-making. In his groundbreaking work, Jeff has studied patients making the most critical decisions about aggressive medical therapies. He's discovered that the steps that help a patient make thoughtful, informed decisions about dealing with cancer can be widely applied to others making difficult decisions. Please join me in welcoming Jeff Belkora.
It's a matter of life and death. Those are pretty dramatic words, and I'm here to share with you some of the dramatic lessons I've learned from my work with people making life and death decisions. In particular, I'm going to share with you a checklist that I developed for life and death decision making that you can use for life and life decisions. So I'll describe that in a little bit. First, I want to give you a little background. I work at a major university medical center, and my colleagues and I work every day with people who are making life and death decisions in the burn unit, in the cancer center, in the spine center, in the emergency room, and it's all very dramatic. But it's not quite what you might think. It's not George Clooney on ER saying, "Code blue, get me a defibrillator, stat." It's actually dramatic in a very different way. The real drama is in those quiet and agonizing moments when a doctor and patient have to discuss the risks and benefits of different treatment options that they're considering. That's when the real drama occurs. And it's all about trade-offs. And I'll give you an example. If you have a tumor diagnosed somewhere very sensitive and delicate and hard to reach, like your brain, you may go to a surgeon and you may find that the surgeon says, you know, there's an 80% chance that we can operate and remove this tumor successfully, but there's a 20% chance that the surgery could kill you. And the oncologist may tell you we can radiate, and the good news is the radiation isn't going to kill you. But there's only a 60% chance of shrinking the tumor with that. And there's another issue, which is that once we've radiated, because of what that does to the tissue, the surgeon may not be able to operate anymore if the radiation fails. Those are hard decisions. So what do? Well, that's where I come in. I'm a decision scientist. And decision scientists help people weigh the risks and benefits of different options. And my work, as I said earlier, has focused on, one of the things I've done is develop a checklist. And we've been using that checklist now, and doctors and patients are using it to think and talk and write more clearly about some of the most important decisions they'll ever make. So I want to share that with you. But I want to share it with you in the context of life and life decisions. Because we know that a high school student, for example, may receive word from the colleges that they've applied to, and may hear from one major prestigious university that they were accepted, and that's good. But the financial aid package isn't quite there. Versus another institution that maybe has a little more modest reputation, but has put together a really more sustainable package for the individual and their family. And so you may face the kind of trade-off. It may not be surgery versus radiation, but these trade-offs have real consequences and will stick with you and your family for a long time. So what are you going to do? How are you going to approach those decisions? So I've developed this checklist, and it's really intended to follow you through your life and life decisions. As you go through college and you pick a major, it's a major decision. The name's kind of a tip-off. And then you go on and hopefully you head towards graduation, and you've got to think about a career path, and maybe you're going to apply to graduate school and take on potentially more debt, invest in your education, or maybe you're going out in the workforce. One way or another, maybe you start to settle down, and now you're thinking about, am I going to buy or rent a house? Am I going to buy or lease a car? Am I going to start a family? And right there you may face some fertility and adoption decisions, or when you have kids, suddenly you're going to face a whole lot of decisions and a whole lot of trade-offs. You're going to need to deal with child care. You're going to need to deal with all the financial issues. You better start thinking about that college education yourself for your kid. So throughout this journey, we're really making decisions, and we're facing trade-offs. And so I've developed this checklist that I want to share with you today in the program, and we're going to go through it, and you can pick up a copy from Amy in a few minutes. And I've also developed an example. I always want to tailor an example to the audience. So we've got a speaker example, applying this checklist to the decision of whether to speak full-time or part-time, something many of us will face. And we're going to go through this and do some exercises and games, and when we get to the end, in conclusion, I'm going to thank you and say thank you for being here. thank you for paying attention to, really this is my mission, is to promote awareness of the importance of doctors and patients making life and death decisions in critical situations, but also college students making life and life decisions. And just by being here, you've supported that cause. And you've supported the cause financially too, because 100% of my speaker fees for this kind of engagement go back to the work I'm doing with patients making life and death decisions. And you can support the cause even further by getting online and calling up campusspeak.com/feedback. If you want to support the cause, you can provide some comments to that extent, and the agency will use that in promoting the outreach and the work we're doing. So, in conclusion, I want to leave you with a guarantee, which is that if you take this checklist and you apply it to all your life and life decisions, you will develop a competitive advantage. You will go through life playing chess while other people are playing checkers. You will be able to surf on the sea of trade-offs while other people are drowning in it. And I know that because we developed this and proved it on the most difficult decisions that people can make. Thank you.